Good afternoon. Thank you all for being here today. I want to start today by thanking Attorney General Letitia James for her work on holding drug manufacturers and distributors accountable for fueling the opioid crisis in New York State and right here in Monroe County. I had the opportunity to speak to the Attorney General last week about how the opioid crisis is impacting families and communities here in our county and the particular impact that it's had in Monroe County and the city of Rochester, and I appreciate her leadership on this issue statewide. Just 2 weeks ago, we announced the sobering news that the Monroe County Medical Examiner recorded 238 deaths attributed to heroin, fentanyl, and related substances in 2020, a 31% increase from 2019. These statistics aren't just numbers. Those 238 deaths are people. There are family members, our friends, our loved ones who've struggled with addiction, and their struggle ended in tragedy. The damage caused by opioids is measured in far too many deaths and far too much pain. So that's why municipalities, including Monroe County, joined with the state of New York to file lawsuits to hold those responsible for this pandemic accountable. Under the leadership of the Attorney General, 2 settlement agreements to recovered funds from opioid manufacturers and distributors have been reached. As a result, I've submitted legislation to be considered tomorrow night that recommends the Monroe County Legislature authorize both agreements. Under the first proposed settlement, Monroe County will receive between $2.3 and $5.5 million from Johnson & Johnson. This settlement would be paid over a 10-year period. Under the second proposed settlement, Monroe County will receive between $13.9 and $24.6 million from 3 major pharmaceutical distributors, McKesson Corporation, Cardinal Health, Inc., and AmerisourceBergen Corporation. This settlement would be paid over an 18-year period. I am grateful that the Attorney General negotiated these settlements with the companies responsible for seeding such sorrow throughout our community. Her work will give us vital dollars to help prevent and treat addiction, tens of millions of dollars over the next 2 decades. I know these settlements will never bring back the loved ones we lost or ease the suffering many of our families have already endured. No amount of money can do that. But what this money will do is help fund the innovative and effective public health approaches our addiction crisis requires. This money, which comes from the companies who have hurt so many families, neighborhoods, and communities all across our country, must be used to help people. We must guarantee that this money is not spent in any other way. That is why I am also proposing the creation of a trust fund to protect any opioid settlement money that comes into this county so that not one penny should be spent for purposes unrelated to preventing addiction and preventing deaths, and also to fund services in our community that help with prevention, treatment, and recovery programs. And I'll say that again. What I propose to the county legislature is the creation of a trust fund that will protect opioid settlement money that comes into this county so that not one penny is spent for purposes unrelated to providing addiction services like prevention, treatment, and recovery. The trust fund is another level of commitment this administration is making to combat the scourge of opioid and other addictions. When I first ran for this office, I made the opioid epidemic a top priority. Upon taking office, I established the Improving Addiction Coordination Team, also known as our IMPACT team, and appointed the county's first ever Addiction Services Director, Dr. Tisha Smith. IMPACT is an innovative approach that engages in community outreach, makes personal and direct contact with individuals who are actively using, and guides them towards treatment and recovery. We know we can't force people into treatment, but what we can do is be ready. We can be present in the moment that they make the decision to seek it. Those are the kinds of services that this settlement money must be used for. We can't use this money to pay down debt or plugging budget gaps like the nearly $140 million in tobacco funds that we received back in the early 2000s. None of that money went to help the people who are hurt by big tobacco, and that's simply wrong. I know talking about the tobacco settlement money is a bit of a history lesson, but I don't want to repeat history. We have to use the funds that came here for this purpose for this purpose, and it's to help people. So that's why I sent this resolution to the county legislature, so that it would safeguard this opioid money now, and it would safeguard it into the future. So I look forward to the legislature and working together to demonstrate our commitment to our community by enacting this legislation so we can meet our obligation to use these dollars to boost our focus on treating and preventing addiction. We owe the people and families of those battling addiction in our county no less. So with that, I can take any questions that you may have.
Would any of this money be sanctioned for law enforcement purposes as well?
This money can only be used for the prevention and treatment of addiction. So, if it goes towards that treatment, that's certainly an option. And so what we'll be doing is working with our impact team over the next several months working with our impact team to then work with community partners to build out what the plan will be to fund the various programs that need to be funded and the efforts. But we have to make sure that every penny of these settlements goes towards prevention and treatment of those who are suffering.
Do you have a particular program that needs the most right now, in your opinion?
Yeah, well, right now, the biggest issue I think that we have here as a community when it comes to opioids is the connectivity between our systems. There's a lot of great people doing a lot of great work when it comes to opioid response and treatment, but it's not often connected the best way it can. That's why we started the impact team earlier this year. One of the great things our impact team does is that when someone overdoses in our community, they go and visit that person. They visit them immediately, and then they stay with them. So it's not just a visit, connect them to a program and walk away, but we meet that person where they are, and then we stay with them as they walk down that path of recovery. So that it's, because right now it's far too easy, the way the system was designed, to just wander off the path. We don't have those nice warm handoffs between systems. So we need to make better investments in how we're helping people work through the system so that they don't get lost, and so that when they're ready for help and ready to enter recovery, that we are there for them, because they're not always ready right away, right? Everyone's going to be in a different stage of their disease of substance abuse disorder, and so we need to be ready and present to help when they're ready to receive that help.
Do you attribute the deaths to more people using or the potency of the drug?
Well, I'll put it this way. Last year, there was a clear connection between the COVID epidemic that we have and opioid fatalities. What we have here is one, you have one epidemic fueling another one. Clearly the isolation people have felt and experienced, the lack of being able to reach out to get help and the peer support that people need clearly played a factor in the increase in the number of fatalities. We also, though, have a lot more Narcan training that's taken place and a lot more Narcan available into the community. And so the fact that you have that much more Narcan in the community but our fatality numbers are still increases tells you something is going on. And so we have to increase our efforts. It's not just Narcan alone that's going to save lives. We have to reach people where they are. We have to be in the community where people are.
Those are going to be decided who gets the money and how much.
Mm-hmm. So it's going to have to go through a process that's going to involve our community partners, our impact team, and professionals and leaders in the system who know what they're talking about. Right? It's going to be critically important that we use experts in opioid addiction and substance abuse disorder, that we use their lead in understanding how best to reach people. But we have to do a better job of making sure that these funds are directed just to those efforts, and that we have clear goals and mission in mind. Sir?
Johnson & Johnson is a company that's valued easily in billions. Do you think they're paying their fair share for the cause of that epidemic?
So, this settlement, I think, will go a long way towards mitigating the damage that the company has done here. I think that this is a significant amount of resources coming to Monroe County. This is two settlements that we're presenting here. There's more coming down the road. But this is a significant amount of money that I think will make a big difference in our fight against the opioids here. Anything else? Cool. Great. Thanks, everybody. Appreciate it. All right. All right. Have a good afternoon.
You want a quick question off camera? I'm not using the on camera, but
I heard. Yeah. Sure.
You said you're introducing that tomorrow?